So welcome back friends to this channel. So for those watching this channel for the first time, let me tell you all that what we do on this channel is we post clinical cases and followed by the solutions. So if you are that kind of a medico who's interested in cracking cases and clinching your diagnosis, please consider subscribing to this channel. So now in this video, this is a solution video for the last case which was posted on the channel in the form of 4 images. So let us see what those 4 images meant and what was the diagnosis and what was the answer to that final question which was asked. So let us go through the images. So before going through the images, as most of you all guessed it correctly, the diagnosis for these images was infective endocarditis. So let us see in brief what infective endocarditis is. So infective endocarditis, as the name suggests, infective endocarditis. It is the infective inflammation of the endocardium. So let us go through the pathophysiology once. So initially, to start with, there is a damage to the endocardium and there is a formation of a sterile thrombus at the place of damage. So with time what happens is, due to bacteremia, these bacteria, they colonize this sterile thrombus and convert it into an infective thrombus. So and this infective thrombus is also which we call as vegetations. So with time what happens is, these vegetations, they weaken and they get detached from the endocardial lining and they go into the circulation. So as they go into the circulation, what is now in the circulation is infective emboli. Infective emboli goes into the circulation and it can lodge in various organs and it can cause ischemia, it can cause infarction, necrosis to these organs wherever it is lodged. So this phenomenon of infective embolus getting lodged into various organs and in general in our circulation is responsible for most of the symptoms which are seen in infective endocarditis. So now let us see how does a patient of infective endocarditis present. So in general, how would a patient of infection present? The same way endocarditis patient also presents. The patient would have tiredness, fatigue, loss of weight, loss of appetite and lassitude, and the patient can have high grade or low grade fever and even chills and rigor. So this is a general presentation, and most of the patients would also present with splenomegaly, which was one of our images we'll see later. So other than this, there are 2 important phenomenon which occur in infective endocarditis. One is embolic phenomenon and the other is immunologic phenomenon. So if you see in this out of these 4 images, so I'll show you the image. So this is the image of the palmar surface of the hand showing a lesion, and this lesion is called as Oslers nodes. So Oslers nodes are one type of an immunologic phenomenon which is seen in infective endocarditis. And what is the immunology behind this is that it is hypersensitive angitis. Due to hypersensitive angitis, this lesion occurs in infective endocarditis. What is the other lesions which were posted? Yeah. So what does this image show? This image shows a small and a sharp hemorrhage in the nail, which we call as splinter hemorrhage. Splinter means small and sharp. So this is this is not an immunologic phenomenon, this is an embolic phenomenon which is seen in infective endocarditis, and so is with this petechial rash on the leg which we can see here. So out of these 4 images, splenomegaly, which is the radiological scan which we see here, which shows enlarged spleen, then this petechial rash and splinter hemorrhage, all these 3 findings in infective endocarditis are occurring due to embolic phenomenon and not due to immunologic phenomenon. And Osler's nodes, which I told you is due to hypersensitive angitis, is occurring due to immunologic phenomenon. So we have seen these 4 images and why they are occurring in infective endocarditis. Apart from this, what else can be seen in infective endocarditis is, what is the cardiac finding which can be seen is, on clinical examination, the patient would have a newly appearing murmur which was presently not there, or a murmur which was presently there but has now changed in character. Okay, so this can be seen in infective endocarditis, and usually it is a diastolic murmur which is seen in IE. So what is the ocular finding in infective endocarditis? What we call is Roth spots. So these are basically hemorrhages which are seen on fundus examination in the retina. These are called as Roth spots. Apart from this, one more embolic phenomenon which is seen in infective endocarditis is what we call as Janeway lesions. These are also seen in the distal limbs like Osler's nodes, but the difference is Osler's nodes are painful and Janeway lesions are painless. So yeah, these are the main findings which are seen in infective endocarditis. So I hope you all understood these 4 images and why are these findings seen in infective endocarditis and what is infective endocarditis. I hope you all are liking these image based questions, because what I feel is when we read from the book we just memorize these lesions and we actually do not know how do they look like. So this was my purpose behind posting this image based questions. I hope you all like this, and yeah, I'll be posting many more image based questions, and if possible we can also post video clips of various signs and symptoms seen in patients. So yes, keep watching these videos, keep liking, keep sharing, and if you all actually find these videos useful, please consider subscribing to this channel. And if you all have any suggestions, any changes which you all want, you all can surely let me know in the comment section and we'll surely implement it. Thank you.